substernal chest pain.
Los Angeles has one of the busiest emergency medicine systems in the nation.
I've got the morphine and the nitro.
In its 13 trauma units,
She's more diaphoretic. Nitro started at 5 mics.
dramatic struggles unfold every day.
But it's going to help take some of your pain away.
In LA, those real-life emergencies are also the scenes for must-see TV. As doctors practice a different kind of medicine, behind the scenes. Burbank, California, home to some of the world's biggest movie and television studios, including Warner Brothers. The studio behind the most popular medical show on network television and in syndication, ER.
From the top, one more time, guys.
Everyone knows the familiar faces at fictional County General Hospital.
The first scissor when it comes down, because it's all glued together, the outer part's glued together.
But behind the scenes,
Finishing getting everything in, because you were dropping things into place.
the most important people aren't actors.
You inject the contrast at the last minute, it goes into the bloodstream and it lights up. So you have to
They're
inject.
doctors.
Well, the show ER really has an overwhelming central tenet, which is we want to be accurate medically, and we try hard to be as accurate as we can in the way that emergency medicine and surgery is practiced in America today.
Okay, so let's just make sure we got the line right.
Dr. Mark Morocco just started as one of ER's 4 medical technical advisors.
And when the special effects blood comes out, you suck to keep it clean wherever you see.
He deals with every facet of the show's production.
We want to see this in your room. If this is through the window, I think it's not going to play the same way.
Yeah.
So we'll start with the writers, and we'll tell the writers, this makes medical sense, this doesn't make medical sense, you would or wouldn't do this at this particular time.
All right, now what's the next thing? You're just going to do some suction?
Then he helps the director sort out the script's medical elements.
Or what's this thing?
That's the scissors.
We'll go through line by line, and I really serve them in such that I'm there to explain the medicine, explain why the medicine is needed.
What next?
As the actors run through their scenes,
He's going to hand you back the knife, and you're going to hand him a pair of scissors.
he adds the finishing
And he's
touches.
going to come back, and don't cut too deep.
We'll say, you know, when you're doing this, you would be irrigating here, and you want to maybe lean back a little bit here because sometimes this splashes. Little details that mostly doctors would be aware of because that's the way it is.
The leg is going to be open.
Dr. Morocco knows exactly how it is.
Basically, what we're going to be doing.
3 nights a week, he trades in his script for a scalpel.
Yeah, and he's cutting with a knife.
Dr. Morocco, contact central, please. Dr. Morocco, contact central.
Did she ever get more Narcan, by the way? Did we ever get around to that?
No, I don't think she got it.
Okay, she doesn't need it now, so.
At UCLA's Level 1 Trauma Center.
This is a much more sort of spiky feeling. There's much more real adrenaline here. Because there are real people's lives are on the line, and you don't want to screw it up.
Dr. Morocco found his way into medicine after an unexpected setback in his personal life.
And I was in a pretty bad car accident with my wife and was in the hospital for a long time and kind of looked around and thought this was kind of an interesting, very interesting profession.
There's blood along the brainstem and you don't see the basal cisterns.
Yeah, it's completely compressed.
So
In 1997, he started his residency at UCLA.
Does she look like she already herniated? Can't really tell. And from the moment that I first stepped foot into an emergency room as a student, I knew that it was the right job for me. I mean, it's an amazing job. You never see the same thing twice. You get to see the sickest patients. You get to see the strangest patients.
Were you guys involved with her? No information at all? Nobody knows how long?
With his new job at ER,
Century Club?
Dr. Morocco can't spend as much time here as he used to.
It's in the right place. We can always back it up if we need to. Okay, Pam?
But he keeps coming back for more.
Which I think is really important because I get to stay sharp and I really like this job. It's a lot of fun. So the two things inform each other. And although I have to work harder than I'd like to sometimes, it's fun. And the surgery guy wanted us to send off another white count on her. I gotta go look at her again.
Just 5 minutes from downtown Los Angeles is Dodger Stadium, one of the city's most recognizable icons. On this field, million-dollar athletes work hard to stay in top shape. relying on a man who's been with the team for more than 30 years. Dr. Frank Jobe is the Dodgers team physician and a legend in baseball medicine. In 1974, Dr. Jobe watched as a devastating injury struck pitcher Tommy John.
And he was pitching for the Dodgers at that time, and on one pitch, his elbow kind of exploded.
John had a torn ligament in his elbow. Back then, the injury could end a pitcher's career. But Dr. Jobe had a daring idea. He pioneered an operation that has helped over 1,000 pitchers.
Nice to see you.
You too, buddy.
This is your day.
Including Dodger Darren Dreifert.
His ulnar collateral
Jobe's
ligament.
innovation was to transplant a tendon from a crippled player's wrist to his elbow.
And we used the tendon out of his other arm and put it into his elbow.
The operation is nicknamed the Tommy John procedure after its first recipient.
And he has a very stable elbow now, and we're very proud of that.
The doctor also performs a procedure to stabilize the shoulder.
You had 3 home runs in one game, isn't that right?
That's right.
That's just sort of routine for you now, isn't it?
Now Dr. Jobe has developed a program to help players avoid traumatic injury.
Without this, I wouldn't be playing right now.
But it's another one that I'm very proud of.
And I'm proud of you.
Thank you.
It starts with exercise.
They're using their
Like all the
their
Dodger
hands, they have, like,
pitchers,
claws, so they-
Chan Ho Park goes through a rigorous daily program.
He pitched yesterday, 9-inning complete game, 113 pitches. I don't think he fatigued at all.
He's going to have to shoot a low score. Everybody's firing today.
Today, Chan Ho stretches, lifts weights,
What you're doing
and does a series of arm exercises designed by Dr. Jobe.
The purpose of these exercises is to keep the rotator cuff strong and the stabilizers of the scapula and the joint strong, because pitching is such a hard thing on a player's arm that they have a tendency to get weak. And when they get weak, then they start substituting other muscles, and then their whole pitching mechanism breaks down and they get hurt.
To perfect these exercises,
And you bring your arm up like this, and you come over.
Dr.
with your
Jobe relies
arm
on a
the same
combination of sports and
plane as
science,
your shoulder blade.
leaving Dodger Stadium behind for his state-of-the-art laboratory.
And so the more it swells up inside this compartment, what happens, the pressure goes up and everything gets pressed down and the leg dies.
It's 5 days before shooting begins on the set
You
of
can do it a lot of
ER.
different ways, but imagine if my thumbs were under the skin here, pushing up on the skin.
This week,
and
visual effects artist Andrew Clement has to design a fake leg for a storyline about a motorcycle accident victim.
you know what I'm saying? Sure, yeah. So when you look at the leg, you go, that leg looks like it's broke.
What we intend to do, just so we're all on the same page,
Prop supervisor Rick Kearns is in charge of the finished leg.
You know, on the outside of like a fillet, when they pull those big
Dr.
fillets
Morocco
out.
and Dr. Fred Einesman provide the medical details to bring it to life.
The director, but I think you're going to want to shoot this way because you're going to want to be over green to over corday.
Yeah.
Dr. Einesman is ER's medical supervisor.
We're not gonna.
You're not going to?
We're just gonna have enough material so that he can cut some and do a take.
Okay, what does that nerve look like?
And it looks like a piece of sort of wide spaghetti. It's about the same color. It's about the same color as cooked pasta without the sauce.
He oversees the technical advisors.
All right, so the next step then is the cut on this side.
Yeah, and so this is our medial cut, and the medial.
And make sure what you see at home is as real as they can make it.
Where it falls off there.
You know, if you're going to write a chest tube is put in, we put in chest tubes, and you get to see that stuff. And now we used to do that once or twice an episode. Now we do it 15 times an episode.
And dramatically it makes more sense because in the script, the pulse that they get back first is this one here.
On top of working here, Dr. Einesman also spends one night a week in the trauma center at Cedars-Sinai Medical Center.
This is still going to be draped like a surgical procedure, so you're going to be able to hide a lot of stuff.
He uses that experience to help shape ER's
At
plots.
the same time, if we can get, I mean, there's certain movement that occurs.
Noah's episode last year when he was working with guns and trying to get the guns off the street, and the kid comes in shot in the head was something that happened to me. So a lot of them are personal stories.
Real quick, how far would the perimeter of that deformity go?
The medical advisors also provide information on human biology.
in reality, what you have to actually do is sort of retract that big...
And the complex procedures practiced in ERs around the country.
Compartment, which is inside, and I don't know if we need to see very much of that. He would just be in there with a coker, reaching up and slicing through that fascia in deep of the leg. But, I mean, it really is about, that deep. You can imagine where it is. We're ready to go.
Sounds great.
Now it's the artists' turn to make the show's special effects look as real as the stories that inspired them.
Oh, excellent. Excellent.
Hi, tell me what's going on. I need that.
Laurie Robertson lives a double life.
Substernal chest pain. She didn't give me a quality of what it felt like.
24 hours a week.
Mm-hmm. I've got the nitro drip here too. I've got it here.
She works part-time as a nurse in the emergency room.
Start another line over there. You have my notes.
At Presbyterian Intercommunity Hospital in suburban Whittier, California.
Nitro go in that one, and then we can use the lock to draw the bloods we need.
He was unconscious when I found him.
Any idea how long he'd been out?
She also works in a different kind of emergency room.
Name? Hannah Scott.
Oh my God. Page Dr. Jones.
He's not on tonight.
She can sometimes be seen as an extra on the daytime dramas Port Charles and the top-rated General Hospital.
Fight, AJ, please. Please fight.
But she shows her real talent
Hi.
behind the scenes in her role as the show's medical technical advisor at ABC Studios in Los Angeles.
Yep. I'm just checking in. What item are we on now? Generally, I will look around, make sure that all my props are in the right place. Make sure the EKG monitors are going to be seen by the camera, the rhythm that I want to be seen will be visualized, and that everything I need is there so that we have it ready for the set to go. Let's put power to this, because I have numbers on here that'll show up better.
Laurie was moonlighting as a TV actress when she first met the executive producer of General Hospital.
And he said, you've worked in ICU and ER for a while. We could use a medical consultant. And I never realized that General Hospital had a medical consultant. So I interviewed then for that position. And after a month or so, they called me and said I had the job. But I put the bottle up there, and I'm going to write nitroglycerin.
For the last 11 years, Laurie has been behind the scenes, making sure everything looks real. Or better yet, that it is real.
If you guys haven't raised my blood pressure. The blood pressure cuff is a real blood pressure cuff. I put my own blood pressure on it, and that's what shows during the scene. And I will have the cuff on the patient in the scene, so it's going to look like her own blood pressure.
Laurie is also responsible for reading future scripts.
Hi, Johnny.
Hey, Laurie.
How are you doing?
Good, good. How are you? How'd it go down there?
It went good.
Good.
It went good. Everything went smoothly. I will go through them and correct them for medical accuracy. I will change things that nurses say, things that doctors say, make them sound more real, like they do in real life. Now, you know how we were talking about the repeat CT, showing differences on the repeat CT? Did we put that in
But
the
these
script?
are daytime
In the
dramas,
script that he orders.
And we're in fantasy land here, so we have more leeway.
and sometimes
Another CAT scan,
reality
but I
takes a
didn't
back
put
seat
the
to a
results
good story.
from the second CAT scan in there because it just didn't fit.
It didn't fit, okay. People might get better faster. They might get ill faster. They might be in comas for a shorter amount of time. They might wake up incredibly oriented from a coma because the audience doesn't want to see somebody laying in a bed for weeks at a time. Just move that so it's on the other side so the camera can't see it. That pump, yeah, move that. Typically, we would see the EKG monitor.
You're needed on stage, please. Laura, you're needed on stage.
Okay. Oh, well.
Back on the set, a pivotal hospital scene is about to be shot.
Will it not go up? I can put it on this finger if you want. I can put on, yeah.
And Laurie has to be there to make sure it plays just right.
Nicholas, my darling.
At the same time, on another part of the General Hospital stage,
Trustee. It's only temporary. I assure you I will have a petition filed by this afternoon contesting the decision.
And as the
veteran actress Nancy Lee Grahn is taping a scene for her role as Alexis Davis, an attorney.
hands on the Cassadine fortune. And I don't want you representing me in anything. What are you gonna do, kill me too?
Crystal needs me.
To look good in front of the camera,
Hi, how you doing?
Nancy has to work hard behind it.
Donna Jew.
Donna Jew, you want me to touch up?
Uh-huh.
But it's not easy.
Make me look vibrant.
Between shooting and rehearsals,
Vibrant.
she sometimes puts in 17-hour days,
Look natural. See you later, Donna.
6 days a week.
My day very often starts at 6 and ends at 11 o'clock at night.
She's also raising a young daughter, which makes it even tougher to concentrate on staying fit.
I'm so busy that I don't have time to cook things for myself.
Hi.
Alan, I'm so glad you're here because I was just on my way to the commissary for a cheeseburger.
Perfect timing.
You saved me.
Nancy enjoys a luxury most women don't have.
So you're gonna have to invite some of the cast in here. We have pasta primavera. This is a good one.
Ordering fresh-cooked packaged meals from her nutritionist every day.
Alla Romano.
Let me just see one moment.
Okay. If not, I'll do it later. You know, I'm here tomorrow, too.
Eating right means staying healthy
Oh, is this it? This is the... Crystal, is this the blouse?
without succumbing to Hollywood's obsession with being
gone, but
thin.
I like it. Okay, this is my rack. This is my rack of wardrobe. You know, I fall into the trap like everybody else, especially standing in this wardrobe room. You know, you talk to some of these wardrobe people where I'm going, I can't wear that, I look fat. And, you know, a word, again, I never want to hear my daughter hear me say. But, listen, I drive through the Jack in the Box.
Nancy believes the television industry can and should do more to take the focus off weight.
There's just too many wonderful things in this world to focus on, and I think we all need to stop going up to each other and saying, you look so thin, how did that happen? And say, you look so vibrant, you look so healthy, good for you. It's up to us to stop buying the propaganda that's being fed to us, you know? We can change it, it's up to us.
I will make you sorry.
Clear, uh-oh. Clear, 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 clear.
She's breathing on her own, so we'll get her pre-op.
When he's not monitoring the medicine on the set of ER,
But he's good to go to medicine, I think. And I'm gonna
Dr.
get
Mark
sent up.
Morocco is at UCLA Medical Center handling real
That's
patients.
him over in bed 1. Oh, you got that too? Yeah. All right.
Those cases make working behind the scenes of a TV show seem dull by comparison.
That's fine. She's just gurgling like crazy, and if we don't tube her, she will drown.
Folks, it's very noisy around the set here.
Blue surgical scrubs.
Yeah, it's great. I really love it. I mean, I was talking to Anthony Edwards the other day and saying, you know, this is a lot of fun, but you guys, it's really, really fun to be a real ER doctor. I mean, the stuff you do in any given day is really kind of amazing. You're basically catching blood with those. We can put more down there if we want, but...
It's just, what would you do? I mean, that's all.
I would...
Even when the shoots get intense, Dr. Morocco keeps them in perspective.
No matter the worst possible day you can have on the set of ER, the worst thing that's going to happen is somebody's going to fire you because you cost a production money.
She's got a lot of junk.
Yeah, she's good.
What do you want first?
You can give the Sux and the Versed together. But here, the worst thing that can happen if you don't do your job right, if you don't understand your job, and if you don't make your best effort, you just stay where you are. You're the most important. You're the rate limiting factor here, okay? People can die. It's just exactly how did she fall?
For Dr. Morocco, some of the most challenging patients
tell her we're gonna get her
are the
stickers.
smallest
You know what a
ones.
sticker is? Yeah, you know a sticker in English and Spanish, huh? Because the kids can be a lot like veterinary medicine. They can be really sick, and they won't tell you anything, but you have to figure it out very quickly. Kids tend to be very, very healthy, but when they get sick, they drop off really, really fast. Who's their pediatrician?
Dr. Morocco started out doing pediatrics and emergency medicine.
So they'll need to call a pediatric clinic because Dr. Shore graduated, she's gone, so they'll need to get a new...
Which gives him insight into one of
They'll just need to call
ER's
for-
newest
for,
characters.
Like in a couple of weeks. The character of Cleo is a combined pediatrics and emergency medicine resident, and one of the reasons that I was hired, and I think one of the specific things that I bring to it is a sensibility of what it's like to be straddling those two different worlds.
Dr. Morocco diagnoses this little girl with a fractured collarbone.
And tell her that the fracture, it's not a big fracture, it's not a dangerous fracture, it's this hueso aquí, okay? Solamente no es problema acá, no está aquí, solamente aquí, no es big problem.
But his job isn't quite done.
all-important, the very important bride. Unos? Dos, okay? We'll probably put her in a little sling, and we'll give her some pain medicines, and we'll have her follow up with the orthopedic clinic and make sure she does okay. She should be fine. Well, we're busy, busy, busy. Hey, Pam, I still can't find face shields. Do we have them anymore?
They should be...
In the real ER, there's always another patient around the corner.
The paramedics describe him as being a gentleman who has very minimal brain function, a Glasgow coma score of 3. Here he comes.
This time,
This our trauma?
it's a boy who suffered a major trauma.
What's going on?
He was on a bicycle, was hit by a vehicle, not going very far, maybe about 10, 15 feet. Okay. The only wound I could find is a hematoma right there.
He appears to have a broken neck
Who's got the meds?
and may have suffered a brain injury.
Can we get some Ativan up, please?
It's just the kind of high-stakes case that could end up on ER.
Can we get a Foley up when we get a spare set of hands, please? When I'm looking from this hospital into the ER world, when I'm working in this hospital, some part of me is thinking, you know, about the stories that I see and trying to remember them.
The ER team stabilizes the boy and sends him to surgery.
We do the best we can. A kid who comes here, crashes on his bicycle, has probably got as good a chance as he's going to have anywhere, and it's kind of cool to be a part of that. I should have given you, this is Binky the trauma bear right there. So, if you're really sick, if you look up and you see me and Binky, it's bad.
I've got a color chart here so I can...
5 days before shooting, visual effects artist Andrew Clement is on the set of ER, preparing to make an exact replica of an actor's leg. First, he takes pictures, using a color chart to help him match the actor's skin tone.
I'll take a couple shots here, and then I'll probably take a couple shots out in daylight just so I can get a variety of lighting situations. So I can try and make the silicone match as best as I possibly can. I also want to get a good documentation of the hair pattern as well, because we're probably going to punch hair into the leg to match what he's got. This is alginate.
Then he makes a leg cast using something called alginate.
And it's the same material the dentists use if you've ever had a cast taken to your teeth for any reason. Put a little of this in a tray and it tastes nasty, but we just buy it by the drum load and use it on people.
Prop supervisor Rick Kearns also works behind the scenes to help Andrew make his illusions seem real.
So this is, I would say, one of the easier things we've asked you to do.
It's easy, but it has a potential to be a lot of fun.
After 15 minutes, Andrew pulls off the cast.
Now, basically, I'll just put it in a paper plastic bag so it doesn't shrink until I get a chance to get some plaster into it. There we go. Thank you, sir. Thank you.
It's back to the studio where the true artistry begins.
Number 8.
Rick Kearns has the key to one of ER's secret places. A closet that holds some of Andrew's best work.
Couple of these here. Some umbilical cords. It's about a 3-month-old.
These fake babies take a week to build and cost from $8,000 to $20,000. They're all anatomically correct or designed for specific medical procedures.
Right here was for an ear surgery where we tried to implant a hearing device, a cochlear implant.
Rick has been with ER since its premiere season,
Sure.
watching firsthand as the effects evolved.
I think in the first season, if you look back there, we were pretty prehistoric on how we did these, and there's a lot of times where we kind of fudged it with angles.
But the goal is still the same.
I think the idea with making these things is to hold it just long enough for people at home to say, did I just see what I thought I saw? And of course,
What people see are some highly detailed special effects.
this is a double thoracotomy where we cut the chest at mid-sternum and we had that. It was a Halloween show we did that one for. Various other parts. You know, we've had some heads so that we can do real intubations. Or we stick a tube down there. We got some pregnant tummies. I think Hathaway wore this. Julianne Margulies when she was pregnant.
Part of Rick's job is to help bring these props to life.
This sort of deal, you reach in here. Not only are we trying to inflate the lungs, we're trying to time it with the actress pushing the manual resuscitator bag so the lungs fill up at the same time. When they go clear, we have to let them go flat when they zap the heart and all that good stuff. Yeah, so we're kind of hidden down underneath the table.
20 miles away in England, at Centinela Hospital, the special effects are real.
Ready?
They're high-tech tools used in a motion analysis laboratory,
Ready? Ready.
co-founded by Dodger team physician Dr. Frank Jobe.
Go.
With the help of players like Thomas Archie, Jobe and a team of doctors are studying the mechanics of throwing a baseball.
There you go. Maybe turn just a little bit more. Yeah. Now try it and see if you
Their goal is to prevent injuries. So they study which muscles pitchers use when they throw.
What that does is kind of lock your knee a little bit so you don't have a wobbly knee. That gives you a little better chance at accuracy.
To do this, doctors inject tiny wires into a player's muscles, which sends signals to a computer via remote control, showing which muscles they use at what time.
Ready?
Then we have them pitch, and from the recording that we get from these muscles firing, then we're able to develop a pattern of how this works. I think that's very good. I think you've improved a lot.
Based on these results, Dr. Jobe developed exercises for the rotator cuff muscles, which enable a player to throw a ball at high speeds. He also helps players develop a consistent pitching motion, which keeps them on the field and out of the operating room.
That's really our goal, is to prevent injuries rather than to fix them after they're done. And I think if I'm remembered for anything, I'd rather be remembered for some exercises that prevented an injury rather than a surgery that helped someone. There. It's getting better with each pitch.
There you go.
I think you got it.
It was in too tight.
At ABC Studios, shooting is underway on the set of the daytime drama, General Hospital.
That's good.
I'm gonna need to turn
Medical technical advisor Lori Robertson is behind the scenes treating the show's patients.
I don't want this up on your eyes because you can't see you. It's just the way it's folded.
And checking details.
One more.
Lori, are we set? Nice, Lisa.
Leslie Charlson plays Dr. Monica Quartermain.
No, we're sorry.
For her, the toughest part of playing a TV doctor is simple.
Okay, here we go, guys, from the top, nice and quiet.
Oh, the words.
My job is the professional stuff. Your job is the acting stuff.
What Lori does is try to talk us through these words, and sometimes it's that can be the most nerve-wracking. She at least will go through the script if we can simplify, not make us look too silly.
I just make you look good.
Then she will do her best to help us out.
I love it. So the camera doesn't, because we're shooting right here.
Lori doesn't just keep the actors talking. She helps them learn how to play their parts.
You're tired, you're beat, you're scared, you're beat, your chest hurts, it's your heart. My God, you can't live without your heart. Today, the woman in the scene is a victim of a very severe heart attack, and she's a mother of one of the characters. It's kind of put everybody into shock. It's pretty much touch and go. It's something so different. I never dreamed when I went to nursing school and worked in ICU that a job like this existed.
A world away from the daytime television universe.
Mark?
And 25 miles from the set of General Hospital.
Ambrosids. Put him up here for me, if you would.
Technical advisor Lori Robertson is back at her nursing job at Presbyterian Intercommunity Hospital.
His lungs caught. He's
Okay, so has he had a fever with this?
sometimes he's a little borderline warm, and most of the time he's not really have a fever with it.
We see everything from traumas to pediatrics, gunshot wounds, bug bites, everything that you would see in a normal emergency room, we see it. So this has been going on for how many days?
It's been really bad the last week.
After examining the 17-month-old boy,
Hello. When he coughs, does he sound like a barking dog at all?
Lori suspects he has bronchitis.
That actually was what he was. He was a bronchitis. Our doctor prescribed antibiotics for him and gave him another prescription of albuterol, which he had been missing for 3 months. And he will do better after that and probably see his primary doctor.
Sometimes Lori finds life imitating television as the paramedics rush in a patient with severe chest pain.
Back this way.
Blood pressure is 186, 110. Pulse rate 90. She had PACs with NSR. So you got nitro and aspirin 160.
Did that help?
No.
The doctors quickly determine that 79-year-old Ida Wood is having a heart attack.
The medicine the paramedics gave you under your tongue in the field, in the ambulance. You got a little pill under your tongue?
No.
A little spray under your tongue?
No.
Okay, did that change your pain at all?
No.
Didn't help at all. I gave her morphine. That didn't take her pain away. What number would you say your total discomfort would be right now?
8.
8 still.
The doctor decides to administer a powerful drug called TPA.
Are you hooked up with the pump? You can use that for a lock. So we can put the TPA in this one, nitro go in that one, and then we can use the lock to draw the bloods we need.
It should break up the blood clot and open the clogged artery that caused the heart attack.
And we'll just keep titrating that up. This is a medicine I love. It is like a miracle drug, and I've brought this medication onto the shows, and we've used this for someone, a main character on Port Charles, who had a stroke.
You were 10 when you started. Where are we at now?
About an 8.
The drug works just as well in reality as it did on TV.
I've got it here.
Lori and the medical team managed to reduce the pain and save Ida's life.
We as health professionals rarely ever get an attaboy. We rarely ever get a thank you when we save a life. It's got to be internal. And when I save a life, when I help somebody feel better, when I do teaching and I see that light bulb go on, that makes it for me.
As the owner of Creative Character Engineering, Andrew Clement doesn't work in a real emergency room, but he spent 20 years designing masks and effects for dozens of shows, including ER.
My dad was an artist, and this is the only career that I ever found that allowed you to do just about anything you can think of in terms of art. You can sculpt, you can paint, you can draw, and as long as it turns out right, nobody can tell you you're wrong.
Today, he's designing a prosthetic leg.
Cool.
He produces the fake limb from a mold of a real one. Then he paints the leg to bring it to life.
So then I just go in and I add a little breakup of localized color. You know, I usually go in, I start with my reds, and then I go into purples, and, you know, gradually build up a skin tone. So you can look pretty dead and lifeless if you just leave it the solid color.
He also adds a piece of cloth that will appear to be muscle and tissue.
I'm getting out just some miscellaneous fabrics that I use. I use a lot of silks and nylons when I'm actually making the interiors. A lot of the time we need tendinous or fibrous sort of materials, and a lot of the times I'll just go and I'll get different colored silks.
Andrew creates a layer of fake skin that will go on top of all this. He makes it out of silicone.
So this is what the silicone looks like untinted. It's kind of a grayish, milky, off-white sort of thing. So we actually add pigment into it to make it look more like flesh.
He pours the silicone into the mold, then puts it in the oven for 16 hours.
So and I'll get some steam heat going in there, and it'll help me to cure up the silicone in a lot less time, which really helps me make a lot of deadlines.
The layer of silicone skin is now ready to be applied.
Okay, I'm just basically sliding the silicone off of the core. We've got these are registration points to make sure that the skin is in a uniform thickness all the way down.
From start to finish, the entire process takes up to 5 days.
It's a challenge. I mean, it's really nice to have something that's, it winds up killing me, but I really like the ones that really are the more difficult ones, the ones that have to do all these things and have all of these, you know, new things that we haven't done before.
The work being done at the Curl and Jobe Orthopedic Center in Inglewood is just as precise and even more critical.
So you ready for this?
Ready as I'm gonna get.
With Dodger trainer Brian Shear at his side, 28-year-old Mike Metcalf has come here to undergo an operation to repair his injured left shoulder.
Anxious to get this over with.
Mike is an outfielder who was drafted by the Dodgers in 1994.
Yeah.
Since then, he spent 6 years in the Dodgers minor league system.
Right shoulder that you're having surgery on. Go ahead and verify.
Mike's goal is to earn a regular spot on the big league club.
Okay, and let me have your left arm.
But that dream has been put on hold.
Okay, I'm sorry, I'm Mary. I'm your pre-op nurse. Want to come with me? Yeah, okay.
He first felt a pain in his left shoulder while playing for the Dodgers minor league team in San Antonio, Texas.
What is Dr. Gabriella doing for you today?
Slap lesion.
On your right shoulder?
Yeah.
I think it's from just wear and tear of playing every day, and it's tough when you have to go out there and play, you know, 140, 160 games a year.
1 month ago, minor leaguer Mike Metcalf stepped up to the plate for his final at bat.
Because we're going to be taking both your shoulders.
Just right when I started to swing the bat, I could feel it, and didn't hear anything pop, but I mean, I knew something was wrong, you know.
The only trouble is we're probably going to come in from the top side.
Yeah.
So the Dodgers brought Mike to Los Angeles to be examined by Dr. Frank Jobe.
Brian kind of killed me.
Dr. Jobe diagnosed Mike with a tear in the labrum, a rim of soft tissue that sits inside the shoulder socket. It's an injury that's fairly common for baseball players.
The labrum or the rim of the socket has been pushed off, and so it's not stuck down. And that's the purpose of the operation, is to stick it back in position.
This stuff may, I'm going to give you something to kind of help numb this, but it may burn a little.
Without this operation, Mike may never play professional baseball again.
Have a nice trip. See you when you get back.
Are we in gowns?
You're going to be
In Burbank, on the set of the hit show ER,
So I put on gowns or dinner, we're really getting into a surgical.
the day of filming is finally here.
So real stuff to her. That looks so real.
But before the cameras are turned on,
If he really opens that incision up after his first cut, are we going to be able to close it back up for the success it takes?
We're gonna do a little.
visual effects artist Andrew Clement sets up a prosthetic leg for one of today's scenes.
For the first take, just so we can get a shot of him actually forcing the cut open.
After 5 days of preparation, his job is almost done.
You did good work, Doctor.
The action is this. Tightening, tightening, tightening. What next? Now carefully extend the incision, tightening one bolt.
It's time for actors like Anthony Edwards and Alex Kingston to do the rest.
Where in the script is the look.
Yeah, the
Take
look.
the look first.
Okay.
Take the breath. Go back to
Okay.
what you
And
have
then
to do.
and then I go. Don't cut too deep.
As one of the show's medical advisors, Dr. Morocco helps the actors maintain the show's trademark realism.
Do this. Put your hands above mine and hold it.
All right.
And now you come in with the other thing. The first couple of takes can be pretty interesting. There's a lot of cursing and dropping of instruments and things go flying through the frame, but about two or three takes in, it begins to click and they begin to look like a real team in a trauma, a real OR team. And when that happens, it's kind of fun. Okay.
Okay. Then
But
you
wait for
hold
her
that.
to wait for her to nod to tell
Okay.
tell you to hold it in place, because she's
Okay.
going to adjust it a little bit, because you're going to feel these bones come into
Yeah.
place. Too much, maybe a little bit out. Just feel it. Okay, you hold it there, is what she's saying with that nod. You
To be
come off,
convincing is Dr. Elizabeth
we'll have to place
Corday.
this, or we'll have another nurse give that. Check this screw.
Okay.
Hand it back. Take your beat with green. Here goes nothing. Plan it.
Now.
Adjust it. Hold it. What about the anterior?
Alex
tibial
Kingston
nerve?
relies on Dr. Morocco to learn how to use a complex medical device.
Now watch what happens. This is what a pelvic fixator does. You're going to grab on both ends. You're going to move his pelvis into position. It's an open book pelvis that you're closing up, and that's what stops the bleeding. Alex Corday looks like a surgeon should look. She feels like a surgeon. Peter Benton feels like a surgeon. You know, most of that is the actor's work.
What would I have been doing during that time?
Finishing the assembly of, getting everything in, because you were dropping things into place.
I dropped this into place.
The beauty of it is that they've been able to use the reality that they get from myself and the other medical technical advising staff to take that to a new level.
Ready, set,
Nerve.
While the crew shoots on another part of the stage, Alex and Dr. Morocco run through the scene until they get it right.
Call my patient. I'm going to need more Pavulon.
I'll get it. It's beautiful. By the time we get ready to shoot, we should have everything pretty much together. And then we're ready to improvise as we go along. And action. What next?
Now extend the incision.
We love all that stuff, but if it's not real, it's not ER.
Compartments.
What about the anterior tibial nerve?
You should be okay. Just don't cut too deep, and you'll stay superficial to it.
Okay, looks like we have a little inferior labral fray too here.
I think it goes all the way from the top to the bottom, brought up in the throwing position.
Behind the scenes of Dodger baseball,
So we're going to make an interportal here. So let's.
Dr. Frank Jobe oversees an operation on minor league player Mike Metcalf. Mike has severe pain in his shoulder that keeps him from hitting and throwing. One edge of his labrum, the tissue that sits inside the arm socket, has torn loose. That loose tissue is being pinched between the socket and one of the bones that make up the upper arm.
Circle, and you have to stabilize one, and it's painful. So the object of this operation is to...
Under Dr. Jobe's watchful eye,
First of all, we're going to clean up all the frayed edges.
Dr. Ralph Gambardella and his team intend to repair it.
Okay, let's have a probe, please.
It's also...
Dr. Gambardella is one of the Dodgers' team orthopedists.
So that it's
Sarah,
about...
could you throw this up for me here in this Arthrocare? Get it up on
During his 15 years at the clinic,
here we are with that posterior edge.
he has done this procedure more than 75 times.
Let's have the probe again.
Dr. Gambardella uses an arthroscopic probe to examine the inside of Mike's shoulder. He then drills a hole no bigger than a pencil. He passes a special medical tack through this hole,
Okay, you sporting a cannula for me?
which will pin the torn edge of the labrum back in place.
And the device that we're going to be using today is a biodegradable thumbtack, so that the tissue will be held down just long enough to let the healing process begin, and then the device will automatically reabsorb, and then hopefully we'll have a normal situation again.
Just going to put it in just a little bit further.
Dr. Gambardella pounds the tack into place.
As you can see it.
I think that's probably pretty good. That's not bad. I want to look one last time from the front.
He checks for signs of further damage in the shoulder.
Okay.
You can see it's pretty solid there now.
Then stitches it up.
It went very well. The stabilization was carried out very nicely, and there's a good bleeding surface under the rim.
We told him there's a lot of good things still going for his shoulder. Despite the number of years he's been throwing, his rotator cuff looked very good. He hasn't developed any instability in the shoulder, and those are major pluses for a lot of overhead throwing athletes.
In 4 to 6 months, Mike should be as good as new.
You're all done, Mike. You're all done.
And ready for spring training. For Dr. Jobe, it's time to step out of the hospital and into Dodger Stadium. With 162 games a year, game day is always just around the corner. But Dr. Jobe is a physician first
We have a little tack.
and a fan second.
I'm not so much interested in who wins or who loses or the individual scores. I'm interested in the person that we have treated and taken care of.
There's something else that doesn't interest Dr. Job, and that's retirement.
I've been doing this since 1964, and I'll do it for as long as I can because it's fun.
Back on the set of ER, filming has already begun.
Yeah, there's a branch that goes like this, right? And there's a branch that runs down through here, and it runs.
Dr. Morocco and Anthony Edwards do some last-minute preparations for the fake leg scene.
In other words, we're going to be cutting the scissor. In the foreground, Dr. Green is working on a patient with a leg that's about to die. In the middle ground, Dr. Corday is putting that pelvic fixator and closing the pelvis up. And in the background, there's a gentleman who just had a chest tube and an emergency intubation. And they're all happening, boom, 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 right in a row in real time after this disaster at a local convention. You're cutting that opening incision through, incision through, incision through. And so what we've done is we've built this leg so that you can see the outside of the leg, the crush injuries to the skin. And then as Dr. Green begins to do this procedure, you can see him insert a needle into the appropriate place. You can see him decide to make this surgical repair, and then you can see him actually do the surgery. So up, 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 up. Open it up. Hand her the knife. She hands you the scissors. Pick up the edge of that stuff, and that stuff is cuttable.
I think the reason why the audience gets drawn in is because they sense that it's real.
The scissor's going to be like lifting, like this. If this is the fashion of this.
And they sense that it's realistic, and the only way that it can be realistic is the fact that, you know, our tech advisors work so hard at making us and teaching us to do it the right way.
Well, the point of it is it's the same beat as what, well, you put the guy...
You're always eavesdropping and listening in on their stories of how they've approached things, or, you know, Fred's taken me and we've gone to USC and watched. And to go back into the environment again, into the real hospital and see it is always really refreshing.
If you go down deep like that, you might get the edge of the scissor down deep enough to cut it on one of the branches. You might not. Right, okay. That's what I'm worried about. Yeah. Some of the failures of past medical shows, even medical shows that were a hit, have been when they sort of slide away from the medicine and become about something else. And as long as we stay grounded in the medicine, the drama comes out of it pretty accurately and pretty organically. We're going to do the scene with the other team in there and you guys out here and try to work the timing out.
Precision is crucial, and the scene doesn't come easily.
What about the anterior tibial nerve? Can you hear me?
The actors keep working until they get it right.
What's next?
Now, carefully extend the incision through the deep fascia of the anterior and lateral compartment.
What about the anterior tibial nerve?
You should be okay. Don't cut too deep and you'll stay superficial to it.
How's he doing?
Who? Mark or my patient?
But it's kind of cool when it comes together because it's very hard to really realistically portray the kind of chaotic poetry that you see in a real ER.
Average reading 65.
I have to open the compartment.
Yeah, well, we're ready.
But we get the people at home sitting on their couch that all of a sudden come up with Dr. Green or Dr. Corday or Dr. Benton and say, holy mackerel, how did I get here? How did this happen? And how do we fix it?
No matter how grim the prognosis, Dr. Morocco always has one consolation.
Dr. Corday.
These doors will be closed.
The blood isn't real, and neither are the patients.
The best part about it is that when somebody dies a horrible death on ER, after they say cut, I get to take a big deep breath and they get to get up off the gurney and nobody really dies. And that's really cool.